interesting is there are several ways of controlling healthcare costs. One is by controlling the cost of the services that are provided. The other is just preventing people from getting access to those services. And I think we have that debate right now that we have to answer that question. As a just and caring society, are we going to provide access to everyone? Or are we going to say the only way to limit healthcare costs is by preventing some people from having access to it?
I don't think members of Congress are having this philosophical debate right now. Just throw that out there.
What do you think they're talking about?
I think they're talking about the fact that they promised to repeal and replace the Affordable Care Act, and it's been a campaign issue for 6 years, and now they're in charge, and it's time to deliver, and it's proving a challenge because, as our president pointed out, healthcare is complicated and personal, as you all are articulating right now.
So, I think all of us at this table have realized that healthcare is really complicated for a long time.
Yeah.
I would hope that our legislative representatives would understand that they have a responsibility to their constituents, both those that voted for them and those that didn't.
Right.
And that it's really about, the contract that they should have with our citizenry, with all Americans, that Americans should not die because they don't have access to the basics of health care. And I don't think we're even talking here about what I would call premium health care, just basics of health care.
Well, and one of the things that certainly I think is delivered to cancer patients under the Affordable Care Act is the required maximum out-of-pocket limit, right? And that's something for in-network covered services that applies not just in the markets that we talk about in the individual and small group market, but also in the commercial market. More than 10% of employer plans prior to the ACA didn't have a maximum out-of-pocket limit, which obviously makes care in these instances unaffordable for individuals, and they have to choose sort of between other necessities and their health, and that is I think a balance that Washington kind of continues to face.